Good afternoon, everyone. I am Brittany Newton with Georgia Health Information Technology Extension Center at Morehouse School of Medicine. I welcome you to today's webinar entitled Know Your Quality Payment Program Resources. Georgia High Tech formed as a result of High Tech Act of 2009. Georgia High Tech is the only regional extension center in Georgia that is funded and endorsed by the Office of National Coordinator to provide assistance with the adoption of EHR technology and meaningful use. Now we'll turn it over to our presenters, Ms. Phoebe Mills, Program Manager with Georgia High Tech, as well as Ms. Liz Hanson, a Healthcare Information Technology Consultant who also serves as Meaningful Use Specialist to Georgia High Tech.
Hello, everyone. Welcome to our webinar. We're so glad that you're here with us. The objectives that we're going to hopefully address are just a really quick overview of MACRA's quality payment program. What we really want to focus on is reviewing the available resources. This program is really resource rich. One of those resources is the Quality Payment Program website, which the wonderful and experienced Liz will help you become much more familiar with. We'll also talk about the small, underserved, and rural support resources, otherwise known as the CERS resources that are available to practices with less than 15 providers. So we've heard a lot about MACRA. So much has been said about it. What is it really? Quick overview. MACRA stands for the Medicare Access and CHIP Reauthorization Act. It is an historic Medicare reform law, and it was signed by a bipartisan legislature April 16, 2015. The final rule was released October 14, 2016. And what it does, it creates a new framework for provider reimbursement. It consolidates several existing quality reporting programs, and it is supposed to be budget neutral. So MACRA, of course, creates this Medicare payment reform through a vehicle called the Quality Payment Program. And we'll talk much more about the resources that support your success in this. So we have a quick polling question we'd like to pose. How are you planning on participating in the Quality Payment Program for 2017? We'd love to get your responses. Okay, thank you. We really appreciate the feedback that we're getting here. So it looks as if most people are unsure, and some have already decided that they'll participate for a full year. So maybe with the information that you'll learn from the resources that we'll become more familiar with today, you'll be able to make a further decision. So how is MACRA, the legislation, implemented? Well, it creates that QPP, Quality Payment Program, as a framework for achieving the objectives that MACRA has set forth. So under the Quality Payment Program are two different tracks, MIPS or APMs, and they provide for the measuring and reporting systems. So of course, the Quality Payment Program is part of a broader push towards moving healthcare from fee-for-service to giving more value and quality. So the Quality Payment Program, as mentioned, has two tracks. MIPS, Merit-Based Incentive Payment System, is what MIPS stands for, and also the Advanced Alternative Payment Models, or APMs. A little bit about APMs. They are for organizations that meet certain criteria. It's a payment approach that gives additional incentive payments to provide high quality and cost-efficient care to Medicare Part B populations. And it can be built around specific clinical conditions or care episodes or even around a particular population. And the advanced APMs are a subset of APMs, and they allow practices to earn more for taking some risk related to their patient outcomes. They can even earn a 5% incentive payment by going further and improving patient care and taking on risk through an advanced APM. So the 5% incentive payment would not be realized until 2019 based on your participation in 2017. So we're going to spend more of our time focused on MIPS because there are 4 performance-based payment adjustment categories under MIPS. And most providers, the vast majority of providers, will fall under or select MIPS as their track to participate in the quality payment program. MIPS, very briefly, combines the following previous programs, quality and reporting programs, into one. It does away with the sustainable growth rate, the physician quality reporting system, or PQRS, the value-based payment modifier, VBM, and also replaces meaningful use or changes meaningful use into what is now advancing care information. So what are the potential impacts on providers who either choose to participate or don't? What if you really work hard to achieve those incentives? What are some of the positive results? Of course, there is the bottom line, that the payment adjustment will be positive, but with the popularity of the physician rating system, many clinicians will see that patients are comparing them to other providers and making decisions based on that comparison. So your reputation as an excellent provider will be impacted by your scores. And of course, the early adopters will get ahead on creating the workflows and establishing a baseline that leads to success in this program. And then there are the negative impacts of the payment reduction of up to 4% the first year. Again, a negative reputation impact. And there will be more pressure as the system transforms from fee-for-service to value-based to meet the thresholds. And the negative payments will actually become steeper and get into the double digits as time moves on. So what is the timeline for participating in MIPS? Eligible clinicians who perform above the threshold will receive positive payment adjustments that correspond to the diagram starting in 2019. So you'll collect your data in 2017, and it will impact your payment, your reimbursement in 2019. And as it says, a positive 4% or a negative 4%. Clinicians who fall within the lowest 25% of the performance threshold will experience payment reductions. So it's as if you are being rated against fellow clinicians. And those who are exceptional performers, they'll receive additional positive adjustments from a $500 million fund that will be available each year from 2019 to 2024. So the quality payment program, when does it start? Well, it actually started on January 1st of 2017. That's when you can start collecting the data that you will report on, So there is flexibility. This program was designed to incorporate greater flexibility for clinicians to ease their reporting burden. And so you start collecting data January 1st. The last time you can actually start collecting data would be October 2nd, because you do need a 90-day reporting period. So you'll need from October to December to have those 90 days. And you'll submit your performance data by March 31st of 2018. We mentioned that we were really going to focus on some of the resources that are available to clinicians to be successful. There are local quality improvement organizations. You have Georgia High Tech, which is your regional extension center for support. There's the QPP website, which we'll spend quite some time talking about, and Liz will demonstrate. There's also a QPP helpline, and you can find that number referenced on the website. So there's lots of support for large and small practices. You can also look to your professional societies for information, HIMSS, MGMA, and ACO. So now we're going to turn this over to Liz to guide us through a tour of the QPP website.
Thank you, Phoebe. So we are going to spend some time today doing actual demonstration or looking through the QPP website. And as we look through this site, we're just going to touch on all of the resources that are there. We do recommend strongly that you go in and take a look at these resources, browse through, look at the materials that are available to you, so you know what you have access to. Now, when we first go into the QPP site, which is located at qpp.cms.gov, where the intro or landing page actually gives you an opportunity to handle something that several of us have been challenged with, and that is knowing whether you're going to be required for each provider to participate. And many of you have not received the letters that tell you whether your providers need to participate. And so one of the things they've added recently to this site is the ability to come to this landing page, type in a provider MPI, and determine whether they're going to be eligible to participate. So right now we're going to put one of these numbers in and let you see how that works. And the system will go through and it will pull up a screen that gives you information on this particular provider. Specifically, it'll tell you right at the top whether this provider must submit data for MIPS or whether this provider does not need to submit data for MIPS. And sorry, we've got a little bit of a lag. I'm trying to get the technology to catch up with my mouth, which, as most of you who know me, knows that could be a problem. There we go. So as we look at this, we see that this particular doctor, Dr. Guresso, and I want to give a shout out for Paige for letting us use her MPI, her provider's MPIs. You can see that it says at the very top that Dr. Guresso must submit data to MIPS by March 2018. It also tells us that down at the bottom, it tells us under practice details that it's included in MIPS because he did have more than $30,000 in Part B allowable charges, and also because he had more than 100 Medicare patients. So this is how this particular tool works. If you want to put in another MPI and check another provider, then you would simply scroll back up to the top and enter the new number. So we're not going to go through that, but did want you to know that we recommend that you use this site to look up every one of your providers, to include nurse practitioners, PAs. You just want to check and make sure you know whether they need to participate or don't. I do have to say that most of our folks that have providers that don't have to participate still plan for them to do so, so they'll be ready for next year with those providers. Okay, so now we're going to take a look at some of the subheadings. And if you look at the top right of the web page, you'll see that we have the MIPS reporting. And if you click on that drop down, you'll see that you have the overview of MIPS. And if you click on the overview, then the system will bring up a screen that provides you with the 4 categories that are used for MIPS, which are quality, improvement activities, advancing care information. And then we also, when you go to this site, it will have some information on the cost component, but wanted to let you know, just to reconfirm, that the cost component will not be part of your 2017 reporting services. And I do apologize for the lag. It's a little slower than we had anticipated, but that's okay, we'll make do. So if you were to scroll down on this page, it does give you some information about around the MIPS program. And it is pretty valuable information. One of the reasons we're so delighted with this site is that most of the information on it is pretty pertinent to all of us. Now, if we go back to the drop-down for MIPS, we will see that we can choose from several other categories. We can look at individual or group participation. What are the recommendations around that? We can look at what you have to report. We can also look specifically at the measures, such as the quality measures, the improvement activities, or the advancing care information activities. And so the first thing that we're going to do is we're going to go ahead and take a look at the improvement activities. And what we wanted to do is let you take a look at the section that is most new to us. Most of you did participate in PQRS, so you have some experience in the quality measures. You know that there's over 300 of these, and this site does list all of the quality measures and gives you a description on how to participate with those quality measures. And it also gives you some information on what your scores will be if you participate effectively with those quality measures. So we have, the other thing is you can also go look at the site that explains your options for your advancing care information component. And just wanted to let you know that you do have two options for this component, depending on whether you're fully utilizing an upgraded 2015 certified system, which most of you are not, or if you're using a 2014 certified system, which is what most of you have. So the measures are different, and those with 2014 certification will choose the transition measures, and all of that information is right here on this site. So if there's any question about what you want to do and what those measures are, they're all listed on this site and real easy to get to. And when you do this on your system, it'll be a little faster in the transitions. Okay, so now we want to take a look specifically in the improvement activities. And the reason I want to talk specifically about this one is because it is new for most of us. If you're participating in TCPI, the Transforming Clinical Practice Initiative, then you've been in the middle of improvement activities for quite some time. If you are a patient-centered medical home, you have absolutely participated in some improvement activities to get that certification. But most of us have not. So our word to you on this is, do not be afraid. Once you understand and once you have found a few activities that work best for you, this is not very hard to do. And the exciting thing is, for those of you that are in practices with 15 or less providers, you only have to do 2 of these if you use 2 20-pointers. So we do recommend that you do 3 just in case, but you do only have, most of you will only have to do 2 of these for this year. And what we see here is all 92 activities. And if you go to one of these activities and you click on that activity, then what you will get is a description underneath that tells you what the activity ID is. It tells you what the subcategory is. It tells you what the activity weighting is. Medium weight is for 20 points. And it will also tell you a description. Now, something that we're not going to look at today, but we can certainly provide for everyone. In retrospect, I should have provided it for you to download right now. There is a document that is the MIPS data validation document. And what this document does is tell you exactly what you have to do to document each of these activities. And I want to just take a brief minute and explain to you why I'm saying this. When we submit for quality component, we're going to be submitting data with numerators and denominators, similar to the way we did with PQRS, and you're used to that. When we submit for the advancing care information component, we again will submit numerators and denominators for all but a couple of yes/no questions, those being the security risk assessment and your immunizations or registries. By and large, you're accustomed to that if you've worked with meaningful use, so this is not something new to you. However, right now it looks like to submit for your improvement activities, you will go to a site, similar way you worked with meaningful use attestation. You'll pick the activities you did, and you'll simply say, yes, you did it. Now, for those of us that have been through audits over the past 8 years, we know good and well that yes, you did it is not good enough if you have an audit. So our approach is to prepare you for an audit with your documentation as you are achieving the improvement activities. So again, we want to document as we go. And the MIPS validation report tells you what activity and documentation is required for each of these 92 sections here. So we want you to use a combination. And we'd like to give you a little word of warning. If you're looking at one and it looks super easy to do and you say, oh, this is the one we're going to do, we're going to participate in the annual registration of the prescription monitoring program. Well, I have to tell you that's one of the ones we're recommending because it's pretty easy to use. But if you go to the data validation report, you will find that if you look up this particular activity, that it actually requires 6 months of participation. So even though it is very easy to do, it's easy to register, the documentation requires that you participate in this for at least 6 months, which mean, and you've got to prove it. What this means, folks, is if you want to do this, one of the most easy improvement activities, you need to get your docs registered for this program by the end of this month, so that on July 1, you can access the prescription drug monitoring program and take a screenshot and prove that you used it. So this is, I know I digressed a little in going over there with you, but I wanted to take this opportunity to tell you, even if you're not sure you want to do this one, please go ahead and register for the PDMP program in the state of Georgia. It is free, it's fairly painless, and if you need instructions on how to do that, if you'll just give us a question in the chat box or let us know, we will get those instructions out to you. Perhaps that is something we can send out in general distribution. Both the data validation report that tells you what's required and the instructions on how to register for PDMP. So please, folks, mark your calendars. If you haven't registered for PDMP, then put that on your to-do list this week. Please get it done this week because it does have to be processed for the approval. So I appreciate your patience and letting me go through that. But just to summarize, when you come to look at the 92 improvement activities, you need to read through all of these, folks. You need to see which ones best suit your practice. And as you can see, there's 92 of them. And so you need to go through and look at each of them. And then you need to check and see what the documentation requirements are for each of these, because one may look pretty easy. For instance, lots of folks say, well, we'll do one for smoking cessation. Well, if you look at the one for alcohol and smoking cessation, you will find that it does require some effort associated with behavioral health, and most practices have told me that that one actually turns out to be a little more difficult than we had anticipated. So most of you probably won't do that because you don't have the workflow in place to coordinate with your behavioral mental health institutions with this. So it looks on the surface it'd be a piece of cake. When you go look at the description or you go look at the documentation requirements, not so easy. So we want to make sure that you utilize all of these tools and pick up the ones that look the best. I will tell you that the most people that we've worked with on this particular component have looked at PDMP and some of the patient engagement, such as patient survey, and also uploading labs and general communications through the patient portals. That seems to be the top 3. But please, read them all, pick out maybe your top 10, then meet with your providers and see which ones they think they can handle. And we will have a program going forward. We'll talk about how you document and what you have to do for this, but we appreciate you letting me go on about the improvement activity because we haven't spent much time on it in the past. But the great thing is all the information is right here in the quality payment website. And so what we want to do is now we want to just take you briefly to the educational portion of this particular website. So if we go up and we click on if we scoot on over to About and click on the Resources Library, excellent. Then you'll find that if you have insomnia, folks, there's a document here for everyone. We don't necessarily recommend that you read the official rule, but if you so choose to, you may, of course. It goes through the legislation. It talks about shows you the participation status letter. Again, we mostly recommend folks just use the lookup on the landing page for this site. And then it goes into webcast and different documents that are available for you to go through. And we certainly recommend that we don't recommend you read all of these, but if you haven't participated in a basic MACRA webinar, then you might want to take advantage of some of these tools that are available. If you're a vendor, then there's information for vendors. There's measure specifications, there's measure fact sheets, there's information on patient surveys, There's more information you could possibly want to read. And if you'll just look at the dates that run down the side of the screen, you will see that they made updates on June the 15th, 2017. So they are constantly updating this document with additional information. And you can come in at any time and access the information that looks good to you. From time to time at Georgia High Tech, we will probably recommend some light reading off of this site.
And that's the validation.
Yeah, the MIPS validation. We haven't scrolled down to that yet, but the document that I told you about that includes the descriptions for the quality improvement. If you scroll down, you'll see that under the MIPS data validation report. So we do want to encourage you to use that. We also want to mention, folks, that if you have a question about this, and you may be working with Georgia High Tech or one of your PTNs for your Transforming Clinical Practice Initiative. But if you can't get one of us, then there is a helpline for this site. And these folks are the most friendly that we've ever encountered when calling up the federal government and asking for some assistance. So we do ask, if you can't get a hold of one of us or you're not working with any of us, that you do call the QPP helpline and ask them their questions. And they just do a really good job. And so we do encourage you to utilize that. And of course, you can find access to that helpline through the QPP site. So that's all the time we're going to spend going on here. Again, important things to remember: the web address, which is qpp.cms.gov, and then just use the tabs at the top for your drop downs to look at MIPS, a little bit of information on APMs, and then some general information and your resource library. So please access those at your convenience. And some of these articles or some of this information you read may cause you to have more questions, but that's okay. We encourage the questions. The more questions we get, the more we all learn. And of course, we all still are learning about this program, and indeed, we don't actually have all of the decisions and all the rules available to us from CMS yet. So we just encourage for you to be patient and to continue to ask questions. So now what we want to do is we're going to go in and take another polling question. So this wanted to know if you were familiar with the QPP website, if you were not aware of it at all, had you heard of it but never used it, have you visited the website and don't count what we just did, or have you used the QPP website for any support activities today? So please take just a minute and answer the polling questions for us. Okay, great. Thank you so much for your participation. We do see that most of you have visited the website, and many of you, over a quarter of you, have actually used some of the information on the website. So that's great. Maybe you'll let me know who you are, and we'll let you help do the next webinar on the QPP website. But we do say and recommend that those of you that are familiar with it, help your neighbor. If you refer to other providers or you get referrals from other providers and they are struggling with MACRA, recommend that they use the QPP website. If nothing else, just to have them relaxed a little so they understand that this is something that we can all succeed with. It's just going to take us a little work and a little education. Now what we'd like to do is we would like to just take a few more minutes and talk about what other resources are available. And there are specific resources available for small practices. So this particular initiative is called the CERS. It is for small, underserved, and rural support. Typically this applies to practices that have 15 or fewer providers. This initiative is made up of local organizations that will provide this support for the small and rural practices. That support will include selecting and reporting on particular measures and activities to be successful under MIPS. It will provide continuous quality improvement engagement, how to plan for quality improvement, perhaps how to use a quality improvement methodology such as PDSAs or Plan, Do, Steady, Act, or Lean or Six Sigma. Will help, those resources will help you optimize your health information technology within your practice as applies to MIPS. and we'll help you evaluate your options for joining an advanced alternative payment model. We will have to say that there's not a lot of alternatives right now, but as time goes on, we do anticipate we'll be able to provide additional support and advice and which direction to go in the future. Probably not for this year. And of course, this support will help you navigate the quality payment program and should be specific to your practice's needs. So, as we look at who provides these small, underserved, and rural support, we'll see that there are several groups available nationally. Alliant GMCF is the organization that supports Georgia. And if you'll see that they actually support the green states in the map, which is Florida, Georgia, North Carolina, and South Carolina. And what we have here is the website for you to make an inquiry or send a question or information to if you feel like that's something that you need to do. So in Georgia, you would come through Alliant Quality, and that is the group that Georgia High Tech actually works to support. Oh, and here's my flyers coming in. Sorry, thought they were gone. There you go. There's the one that's for Georgia. Okay, now, and moving forward, we want to take a look specifically at what this support includes and who Alliant is. So it includes funding for direct technical assistance to local experienced organizations. This direct technical assistance is in the form of virtual assistance. Typically, we'll see that through virtual office hours, at least every other week that are a set time, and for screen sharing capabilities when necessary. And I think we pretty much covered all of those. Just want to let you know that Georgia High Tech is funded to provide this support in partnership with Alliant for the state of Georgia. And those of us that work with Georgia High Tech are delighted, and we hope that those of you who worked with us will be delighted as well. Alliant Quality is the Quality Innovation Network, Quality Improvement Organization Network, which we call QINs and QIOs. That's neither here nor there for most of y'all, other than to know that it is an incredibly effective resource and has helped many of you with PQRS in the past, or maybe some improvement activities that you've done within your practices in the past. And they also provide support in doing assessments for TCPI. So Alliant Health provides solutions for organizations and is making health care better in over 7 states. And of course, one of those 7 states is Georgia. Here is the website if you would like to sign up to participate in the small, underserved, and rural support effort that is provided by Alliant and by Georgia High Tech. Then you can go to this particular URL and fill out a very, very short survey, and that will register you for the CERS program, and it will also be forwarded to the appropriate representative so that we can contact you and begin to assist you. And as you can see, second on this screenshot from this site or this survey is the Georgia Health Information Technology Extension Center. We're excited to see our name up there and look forward to helping you. So, what services are provided under Georgia High Tech? We will have virtual office hours on the second and fourth Thursday of every month at 12:30. The format will be, we will do some introductory slides talking about a specific component under MIPS typically, and we will have time to have question and answer to discuss the questions you might have around the particular issue that we're going to talk about. Next Thursday is the first meeting, I believe, and it will be more of an introductory meeting, but we will welcome you to participate, and we'll take your questions probably for responses at the next section, which will be the second Thursday of July. So we also will provide updates and announcements and newsletters through the Georgia High Tech listserv. We will provide, for your practice, an overview of the Quality Payment Program. We will assist in checking your participation status if you've not done so. We'll provide a gap analysis that looks at where you are and where you need to be and what you need to do to get there as far as the MIPS program is concerned. We will look over your advancing care information measures, typically using a MIPS report or using a meaningful use report, because many of you don't have a MIPS report yet. We will review the quality component status. That means that we'll look at your quality and resource use report, which is your QRUR report. And by the way, if you don't know what that is and don't know how to get to it, we'll tell you exactly how to do that. We may look at your clinical quality measures to get a gauge for how you're doing now. That QRUR report is historical, so we might use your CQM report or another method through your EHR to see what your quality measures are looking, how they're looking. We'll discuss what your options are, and we'll discuss what's best for your practice. We'll also help you go through your improvement activities. Please note that, again, we did recommend that PDMP looks like a good alternative and an easy alternative for most of you, but you got to get registered. And then, of course, we'll help you with the planning and give you some documentation guidance for your improvement activities. Some additional services that will be available, not through the CERS contract, if you will, but additional services that are available through Georgia High Tech include your security risk assessment, which is a minimum requirement for your ACI component. We can assist with detailed QRUR analysis, which is important now for your quality measures, will be critical towards the end of the year in looking at your cost as you prepare for 2018 participation. We can provide on-site assistance. Again, that is outside of the free services through CERS. We can provide extended MIPS support. We can provide practice orientation where we actually present to your group, either your providers or the entire staff. We can assist with your efforts for patient-centered medical home, health information exchange, and if you're Medicaid, we can still help you with Medicaid meaningful use. And that is under a grant type environment from Medicaid services. So we're still excited to participate with that. Here are 2 links that you can use to join Georgia High Tech as a member. Many of you are, or how to contact us if you have a question that you'd like for us to answer. So here's another polling question. And this question is, are you planning to participate in MIPS? And if so, do you anticipate needing assistance through CERS and hopefully through Georgia High Tech? So if you would respond whether you're planning to participate fully and need assistance. If you have it under control, that's excellent. You may want us just to kind of follow up with you. Perhaps you just need that you're going to have minimum participation and you'd like some assistance from us. Or perhaps you're not participating at all, but you still might want to take advantage of us as you plan for 2018. So if you would just take a minute. Love seeing that a lot of you seem to need assistance, so keep those going. And we anticipate that all of you will be filling out that survey so we have your contact information and so you are tracked for grant reporting purposes. So very good. So we appreciate you participating in that poll and look forward to hearing from you as you complete that survey. And now as we go to close out this particular webcast, we'll go to our next slide and say that there are additional resources that are available to you. There, of course, is the QPP website, which we focused on in the middle of this webinar. There is the APM Learning Model support. You can click on this link and see what's available for you in reference to education. There is the Transforming Clinical Practice Initiative, or TCPI. There are several PTNs that can provide support in the state of Georgia, and we'd love for you to participate in that program. And you can click on this particular site and get more information. And of course, your quality improvement organization, which in Georgia is Alliant Quality. Additionally, there are resources for patient-centered medical home, or PCMH. And although we didn't focus on it and didn't talk about it, there is actually some free assistance, virtual, for practices that are larger than 15 providers, and that would be through Alliant Quality. And again, you can click on their link and inquire as to how to participate in that support. So, your path to success, just in summary. Please participate in any available webinars, be it from the Regional Extension Center, from HIMSS, through Alliant Quality, through your HIE, or through the CERS virtual office hours. You will receive more information on that from our mailing list. Use your professional society resources if there are any. The more you hear, the more knowledgeable you'll become, the more comfortable you will be with this information. Please participate in CERS or with the large practice assistants available if you need any assistance, or if you just need a simple question answer, we'd be glad to entertain those for you. Utilize the QPP website. Educate your staff. Folks, don't try to do this alone, although typically we find there is one or two individuals that will be the foundation and will actually, for the most part, make this happen. This is an ongoing transformation. You need to educate your staff on what it is, where it is now, and where you're going with it, so that everybody can contribute most effectively. Initiate community of care, community of practice meetings with the practices you refer to or who you receive referrals from. Don't try to operate within an island. You will find, especially on the advancing care information component, that health information exchange and co-care management is a pretty critical piece of being successful with this program in subsequent years. Might not hurt you too much this year. Upcoming years, it will be critical. Determine which track you're going to participate in, MIPS or APM. Most of you will participate in MIPS. We do have some folks that are APM, but they're not track 2 or track 3. So plan on participating in MIPS unless you know for sure otherwise. Determine your method of reporting. Will you report individually or as a group? Will you report data through your EHR, through a registry, or in the quality component in a claims-based environment? We do want to mention that, and look at whether you're going to report for just the test mode to keep from being penalized, whether you're going to do it for 90 days or more to maximize the reimbursement that you can receive. And then determine the risk, folks, that you have if you don't report. If you do report and report through claims, which on the quality side provides you with less points than if you did it through your EHR. So understand where you are at risk, what types of issues can lower your score, and how you can maximize your score for your individual providers and or as a group. Review and analyze your meaningful use or MIPS reports if you have those available. Do the same with your quality reports and your QRUR report, which is your quality and resource use report. Again, if you don't know how to get those, you need to let us know so we can help. Select the improvement activity that best suits your practice and that you can actually make happen within the next 6 months for the end of this year. Most of them have a 90-day minimum reporting period. And as you know from PD&P, it has a 6 months. So make sure you understand that and pick one that you can do without a great deal of pain this first year. You can get more creative next year. Determine where you are now, make a plan, work your plan. If you can't participate in TCPI or PCMH, we do recommend that you do so. It can make a difference, and especially your improvement activity section. Okay. So earlier in this presentation, you saw this work of art, and it said that it was the path to payment, and it was just a maze. We hope that the resources that are available to you, the quality, the QPP site, Georgia High Tech as a resource, Alliant Quality as a resource, and your TCPI coaches can help you take a shortcut through this path. So we do look forward to that opportunity. We are going to take some questions, and we already have some questions we'd like to just review. There was a question on how to sign up with Georgia High Tech. We have a slide with that link in it, and I do believe everybody will be receiving a copy of these slides or can download them right now from the downloadable webinar presentation that you see in the bottom left corner of your screen. So you can download these slides right now, and there is, the website is provided for Georgia High Tech, which I believe is GAHITEC.
ga-hitec.org.
Thank you. Actually, I did it last night without the dash, and it worked. I'm just saying.
Okay.
Okay. Next, instructions on how to register for PDMP. This is something that we'll have to put up for you. I can tell you that if you just Google PDMP for Georgia, or if you may have to, I think you can do PDMP, or you could put Prescription Drug Monitoring Program Georgia, and in one of the top sites, it'll bring up the PDMP site, and you can click on that, and it can take you straight to registration. But we will provide you with this information via email in the next day or so. And someone asked you, Karen, you actually asked about the PDMP. I'm glad to see that. I'd like to see some more of my folks asking. And Mary, you asked for the location of the data validation report. This is found under the About the Quality Payment Program tab on the QPP site. If you click on that tab, you get a drop down for educational resources, and then you would scroll down to the document called MIPS data validation. It is a zip file. You would download it, open the zip file, and within it are a couple of fact sheets and that entire spreadsheet. We will, however, send out that spreadsheet for you, so you will have it readily available. So thank you for those questions. Wanted to see if there are any other questions. Okay, and so thank you, Mary. And so we did see that that someone was asking about the slides. Would they be sent out? They will be sent out in addition to you being able to download them. Well, we certainly appreciate your participation today. I know we had a lot of familiar faces out there. We would ask you to share this information. Share that survey site with any of the other practices you work with, do referrals with, and encourage them to participate. We'd like to get as many folks educated and going forward as possible. We don't have a 3-year ramp time frame to ramp up with, like we kind of did with meaningful use. We need to make this happen this year. And so the sooner we start, the sooner the better. Thank you so much, and hope everyone has a great day.